High blood pressure, also known as hypertension, is a condition where the force exerted by blood on the inner walls of arteries is elevated. Arteries are responsible for transporting blood from the heart to various organs and parts of the body. Blood pressure is determined by two measurements. Systolic pressure. This is the pressure exerted on the arteries when the heart contracts during a heartbeat. Diastolic pressure. It refers to the pressure on the arteries when the heart is in a relaxed state between heartbeats. Blood pressure readings are expressed as a ratio of systolic pressure over diastolic pressure. For example, 120/70ths or 120/70. Blood pressure is typically measured in millimeters of mercury, mmHg. Hypertension, or high blood pressure, is generally defined as a reading of 130/80ths mmHg or higher. The American College of Cardiology and the American Heart Association have established 4 main categories for blood pressure. The ideal blood pressure falls under the category of normal. Normal blood pressure is characterized by a reading of 120/80ths mmHg or lower. Elevated blood pressure occurs when the top number ranges from 120 to 129 mmHg, while the bottom number remains below 80 mmHg. Stage 1 hypertension is identified by a top number ranging from 130 to 139 mmHg or a bottom number between 80 and 89 mmHg. Stage 2 hypertension is indicated when the top number is 140 mmHg or higher, or the bottom number is 90 mmHg or higher. A blood pressure reading exceeding 180/120ths mmHg is considered a hypertensive emergency or crisis. In such cases, it is crucial to seek immediate medical assistance for individuals with these blood pressure numbers. Also, since we are talking about adults here, let us emphasize that these values will be evaluated differently according to age. Primary hypertension, also known as essential hypertension, is a condition of unknown cause but believed to be the result of complex interactions between genetic and environmental factors that affect cardiovascular and renal function. Although the exact etiology of primary hypertension remains unclear, a number of risk factors are strongly and independently associated with its development, including age, obesity, family history, reduced nephron number, high sodium diet, excessive alcohol consumption, physical inactivity, insufficient sleep, social determinants. A number of common and uncommon medical conditions may increase blood pressure and lead to secondary hypertension. In many cases, these causes may coexist with risk factors for primary hypertension and are significant barriers to achieving adequate blood pressure control. The majority of individuals with high blood pressure do not experience any symptoms, even if their blood pressure readings reach dangerously high levels. It is possible to have high blood pressure for an extended period without exhibiting any noticeable symptoms. In some cases, a few individuals with high blood pressure may encounter headaches, shortness of breath, nosebleeds. It is important to note that these symptoms are nonspecific and typically manifest when high blood pressure has progressed to a severe or life-threatening stage. High blood pressure exerts excessive pressure on the walls of arteries, which can lead to damage in blood vessels and organs. The extent of damage increases with higher and uncontrolled blood pressure levels over time. Uncontrolled high blood pressure can give rise to the following complications: heart attack or stroke, aneurysm, heart failure, kidney problems, eye problems, metabolic syndrome, cognitive changes, dementia. Routine screening is commonly used to identify hypertension. It is recommended that individuals aged 40 and above without a history of high blood pressure have their blood pressure checked once a year. However, individuals with risk factors such as obesity, family history of hypertension, or previous episodes of elevated blood pressure should undergo more frequent screenings. For younger individuals without risk factors, screening every few years may be a reasonable approach. If your blood pressure is found to be elevated during an in-office screening, further confirmation of the results may be requested. This can be achieved by regularly monitoring your blood pressure at home. The reason for this additional step is that many individuals experience a temporary increase in blood pressure when it is measured by a healthcare professional in a clinical setting, commonly known as white coat hypertension. Your healthcare provider will combine the readings from your in-office blood pressure check and your at-home measurements to determine whether you have true hypertension or not. High blood pressure management involves a combination of lifestyle adjustments and, if necessary, medication. Your healthcare provider may recommend the following lifestyle changes. 1. Adopting a heart-healthy diet with reduced salt intake. 2. Engaging in regular physical activity. 3. Maintaining a healthy weight or shedding excess pounds if needed. 4. Moderating alcohol consumption. 5. Quitting smoking. 6. Ensuring you get 7 to 9 hours of quality sleep each night. The choice of medication depends on your overall health and the severity of your hypertension. Combining 2 or more blood pressure medications is a common approach, as it can yield better results. However, it may take some time to determine the most suitable medication or combination for your specific needs. When using blood pressure medication, it's crucial to establish a target blood pressure level. Generally, a recommended goal is to maintain a blood pressure reading below 130/80 Hg if you are a healthy adult aged 65 or older. You are a healthy adult younger than 65 with a 10% or higher risk of developing cardiovascular disease in the next decade. You have underlying conditions like chronic kidney disease, diabetes, or coronary artery disease. It's worth noting that ideal blood pressure goals can vary with age and individual health circumstances, particularly if you are over 65 years old. Managing high blood pressure often begins with the use of first-line medications, which are the most effective and frequently prescribed. These medications fall into 4 main classes. 1. Angiotensin-converting enzyme inhibitors. ACE inhibitors block the production of angiotensin II, a hormone that naturally regulates blood pressure. By inhibiting angiotensin II, these medications help prevent the narrowing of blood vessels. 2. Angiotensin II, receptor blockers. ARBs function similarly to ACE inhibitors by blocking the action of angiotensin II on blood vessel receptors. This action helps maintain blood vessel dilation and lower blood pressure. 3. Calcium channel blockers. Calcium channel blockers work by preventing calcium from entering the muscle cells of the heart and blood vessels. This inhibition allows blood vessels to relax, aiding in blood pressure control. 4. Diuretics, water or fluid pills. Diuretics help remove excess sodium from the body, reducing the volume of fluid in the bloodstream. Often, diuretics are prescribed alongside other high blood pressure medications, sometimes combined in a single pill. It's essential to discuss potential side effects with your healthcare provider. If you experience side effects that worry you, do not discontinue the medication independently. For individuals who are pregnant or planning to become pregnant, it's important to communicate this to your healthcare provider. Some medications should be avoided during pregnancy, and your provider can guide you on safe options for managing blood pressure in such cases.